Hi, everyone. Welcome to the Nursing Dose with your host, Farah. Dr. Laurent here, nurse career coach, and recently just got appointed as the Associate Dean for Salem University. So today I'm so excited to have a special guest on. We have Dr. Mercy Mumba, and she's going to expand on her intro because you guys, she's doing a lot of different things. She's all over the place. She's got all these certifications, education. She also is the Sigma Liaison for United Nations. She's a faculty at Texas Arlington. So many different things that she's doing. So thank you for joining us and gracing us with your presence. And if you just want to tell everybody a little bit more about yourself.
Absolutely. Thank you, Farah, for having me. And first of all, congratulations to you as well, newly appointed Associate Dean. That's just
Thank you.
amazing, amazing. I can't wait to see where life takes you and how many good things you get to do in this role.
Thank
But
you.
you're right. My name is Mercy Mumba. I am currently an associate professor, but was promoted to full professor, and that's going to be effective in a couple of weeks. So I'm very excited about that at the University of Alabama. I'm also the founding director for the Center for Substance Use Research and Related Conditions. I also, like you said, serve on the UN liaison team. So we get to do a lot of work at the United Nations representing nurses in Sigma. And I'm also the president elect for the Southern Nursing Research Society. So I'm excited about my passion there for leading the organization. I've been a member of SNRS since 2012 and just amassed different leadership roles until I was elected as president elect with this annual meeting that we just had. And then I wear a lot of other hats as well. So, like you said, a lot of different things, but I'm also the section editor for the Journal for Psychosocial Nursing and Mental Health Services. I am the section editor for substance use and related conditions. So I get to do a lot of work with that journal as well, and then many, many other things that we'll dive in. But that's good for an introduction.
Right. I mean, seriously, when do you sleep, right? It's like you got all these things going on, but I love it. I love it. It shows that, your wide expertise and knowledge. And I love to highlight nurses on this show, that can do so many different things. And that's the beauty of our profession. So,
Yes.
today we're going to get into really nursing contributions and
Mhm.
how nurses can have a role in global health, because I don't
Yes.
think we talk about it a lot, but
Mhm.
obviously you're involved with the United Nations. You're part
Yes.
of Sigma, which is international. I'm also a Sigma member, so very proud to be part of Sigma. Um,
Mhm.
I just got interviewed. Hopefully, my thing will air in August on the podcast. So I love Sigma.
Awesome. Is that the Nursing Now
Yes,
challenge?
I think it's like, yeah,
Yay.
something like that. So, and I wrote an article for them recently. So I love that you're part of Sigma because they
Yes.
represent, international nurses. So talk to
Mhm.
me more about how did you get involved on an international stage? How did you get involved with the United Nations? A little bit about that so people can kind of
Mhm.
understand that background. And if you guys are watching, let us know if you're watching. Put it in the chat. Let us know where you're watching from, what city, what country. We'd love to hear any comments, concerns, questions. Put them in the chat.
Awesome. Well, I've been a member of Sigma since 2010. I actually got inducted when I graduated with my BSN from the University of Texas at Arlington. And I was just excited because, everyone, my professors were talking about Sigma is a global
Mhm.
organization for nursing. It's a huge deal to be invited. So I was like, wow, it's a huge deal to be invited. How do I get, connected? Because
Right.
I've always had the philosophy that if I'm going to belong to something, I'm not going to be a spectator. And I think that that's something that I even talk about in my book in terms of professional growth and development. You
Hmm.
just don't join things to join things and put it on your resume and say I belong to this organization. So I was very intentional in trying to make sure that when I joined Sigma that I was going to be engaged. So I was very engaged with the local chapter. I participated a lot with the different events. And in fact, because of my engagement, when I was in my PhD program, they sponsored me to go to International Research Congress as their student representative. And that was just a game changer for me because I was in Hong Kong, first time in Asia, and I was like, oh my goodness. And I saw the Hall of Fame, and there were so many nurse scientists there from
Mm-hmm.
all over the world. And having a background of growing up in Zambia, Africa, by the way, I was born and raised in Zambia. I've just always had this issue of I want to know what else is happening everywhere in the world. And being a global citizen, knowing that the things that I do in my personal life may not seemingly affect others, but are really impacting others. And so, nursing in my background of coming from Zambia, Africa, and looking at health challenges and health systems, delivery of care, and all of that, it just always made me very aware of wanting to do more. And so, how then I got engaged with Sigma is that already started doing a lot of global work in my personal life. I was going on mission trips with a church that I was belonging to at the time, and I was also taking students to Zambia back with me because
Mm-hmm.
I felt like that was one of the ways I could give back to the places that I grew up in. And so that work just naturally transitioned to, oh, now there's this opportunity to do something in even a larger capacity at the United Nations because advocacy is one of the things that I really love. And so being in the UN advocacy and policy, those were things that I thought that were going to help me grow, but also give back in more meaningful ways. So I applied for the role of liaison to the United Nations, and Sigma was very generous to select me as one of their liaison, and I've thoroughly enjoyed having that experience.
Oh my goodness. So amazing. Did you guys hear all the stuff she's doing, y'all? I'm telling you, right? She even dropped it. Oh, I wrote a book.
Oh my God. Yes, there's a book out there. Like, get you a copy if you're in academia. Like, seriously, not
Right.
self
What's
promotion,
the
but I've
title?
heard
The
so
title.
many good things.
We'll
The
drop the link
title
later, but what's
is A Nurse's Step by Step Guide to Transitioning to an Academic Role. And you can find it on Amazon, Sigma, Barnes and Noble, Target, like literally everywhere books are sold, you can find it. And I've heard so many great things about it.
awesome. I'm telling you, she's doing all the things. You definitely inspire me, and it's so nice to hear that story. And I'm actually, I was born in West Africa as well.
I didn't know
I
that.
was born in Cote d'Ivoire in Abidjan, but moved
Oh,
to Canada when I was like 9. So that's why, I think it's so important to talk about this stuff because I'm a very, first, proud first gen immigrant,
yeah.
doctorally prepared like you. So it's just so
It
amazing.
gives you a different perspective because you've seen the world through so many different lenses, and it makes you think differently. It opens up your eyes to possibilities that other people take for granted or may not even recognize as opportunities. And that's something I've heard consistently in my career. It's like, Mercy, you've done a lot of things. How are you able to do all of these things? I'm like, my mind is always keen on, is this a new opportunity? Is this a
Yeah.
new endeavor and things like that? But that's because I have so many different perspectives informing my worldview just by the mere fact that I've lived so many different places.
Yeah, and that's why I think it's amazing to highlight, nurses like you. And this is why I love having this platform on LinkedIn, on social media, to share everybody's story and really the power of one, right? Like, a
Yes.
lot of nurses may think, well, what can I do to impact like healthcare globally? Like, this is just too
Yes.
abstract. But there
Mhm.
are so many actionable things that you could do as one nurse, such as
Yeah.
yourself, to really impact globally. So we're gonna dig deeper into it. I'm
Mhm.
just so excited. Like, we probably need like 2 hours to talk about all this.
We need a whole day, Farah. You and I talk too much. I told you this already. I'm like, 30 minutes is not enough.
And I wanted to shout out some very important people that are watching. We have somebody watching from Zambia. Shout out to you. We have
Yay.
Dr. Julia. You.
Dr. Julia, good to see you.
Yes. She is also amazing and doing a lot of things as
Mhm.
well. So I really appreciate you for
And I
watching.
see Dr. Patrice Little as well. Thank you for joining in. Mr. Lakindula, thank you for joining.
Yes. So excited. And guys, drop in any tips that you may have for nurses who
Mhm.
want to get into global type international
Yeah,
nursing and want to make an impact. So let's get into it. I wrote a couple things down, and we're going to share about 5 things that you can do
sure.
if you're watching, um, that you can make an impact and start getting
Mhm.
involved. So, a couple of things you already mentioned. So, the first thing I'm going to say is volunteering for
Mhm.
international organizations
Yes.
and getting involved in like different things like medical missions,
Mhm.
um, different organizations like Doctors Without Borders. There are so many
Absolutely.
things.
There's so many.
Yeah. So, what is your take on volunteering with international organizations? What tips can you give to people out there,
I
even if
think
they're
it's
nursing
so
too?
important.
Yeah.
And Farah, one of the things I hear a lot in conversations with people is, I want to do global work. I just don't know where to start or who to work with. And
Mhm.
so sometimes there's no need to reinvent the wheel. There's
Mhm.
already established organizations with infrastructure that will support your individual endeavors in what you're trying to do. Like you gave an example of Doctors Without Borders. That's a great place to start. For me personally, one of the things that I was very wanting much to do when I first started was I really understood that nursing science was not as very well developed as I would love to see it in my own country of Zambia. And so I made it a point to try to do like seminars and workshops for nurses to improve evidence based practice utilization and uptake, really help nurses practicing nurses understand what evidence based practice was, QI, quality improvement. We talk about that, but also equip the developing nurse scientists who were coming up in their different ranks, who were lecturers and so on and so forth, to build programs of research, or at least start to build programs of research. So I would go back home and do these workshops, like at the University of Zambia. I did one at Lusaka Apex University and tried to build relationships. Those were things that I was doing that were not even part of my job description, right? It
Yeah.
was not expected of me, but I just felt this sense of responsibility to do that. So, actionable things that you can do on a individual basis. I did partner with different organizations. So, for example, when I first started, I used to work with an organization called Koparo Zambia. Shout out to my friend Natasha Suilanji. And what they do is menstrual health hygiene and menstrual poverty, because that was a huge thing in Zambia and in most developing countries. So I worked with them. When I went on mission trips, I brought them along. And now I work with a different organization called Eagles of Change. They are about drug use sensitization and mental health promotion, because that's all my program of research as well. So I didn't try to go and create my own foundation or create my own
Yeah.
organization. I partnered with people who were doing things that I was already passionate about. And you can see, I went from community engagement, service learning opportunities, to even lecturing and providing seminars and workshops. So it's really, nurses are so diverse in what they bring. And then another thing that I did was partner with an organization called International Organization for African Nurses. I served as a vice president for that organization for a couple of years, and we supported different projects in different countries. Like there was a group going to Liberia, and we would help fund some of the projects that they were doing in Liberia, and so on and so forth. So there's a lot of different things that you can do. My big thing is, you don't have to reinvent the wheel. Partner with somebody who's already doing something in your space. Find ways to move their mission forward, because sometimes I find that people are just waiting for the right moment and waiting for this big budget before they do something. And I'm like, no, you can start where you are. So
Yeah.
those are just some of the things that I've done on a personal level, and just to throw out ideas. Dr. Julia is here. Dr. Julia and her foundation, in collaboration with International Organization for African Nurses, we used to do, and I think they still do that, the suicide walk. We had a conference that Dr. Julia was able to be a guest speaker on. So we've done a lot of different things. Partner with someone, you don't have to reinvent the wheel. There are organizations that already have the infrastructure to get started.
Yeah, so Dr. Julia Yu says global work is so rewarding. The prayers and love from the people on the ground, you can't get anywhere. They are grateful for very minimum, and I do a lot of global work. I love it. Yeah, it is so rewarding, like you said. And I think one big piece is, um, like you said, finding something that you're passionate about, and so that you
Absolutely.
be very purpose driven, and pick something that's in alignment with your values and your purpose, so that it's kind of easy for you to go that way. Um,
Yes.
Definitely, that is great gems that you just dropped. And then number two, you kind of touched upon it, is really participating in health education and training programs, or
Yeah.
like you said, developing your own, so you can disseminate globally to different,
Yeah.
organizations, working with universities, things like that. So is there, anything, and you talked about networking, because I think really that's key, because some people might be like, all right, I have this great idea that I
Yeah.
want to share, but how am I going to get into these universities, or, and, get connected where I can share this health, and, health information, or health education or training programs. So what are
Yeah.
your tips on that?
I tell people that there's a lot that we have expertise on. For
Hmm.
example, let's just say your area is maternal child health. There's a lot of maternal child health disparities in a lot of developing countries or low to middle income countries. I mean, there's a lot of
Here.
disparities right here in the US. Like, let's talk about that. We're talking about Black maternal health.
Yeah,
Like, oh my God, don't even get me started on this conversation, right?
I
There
know.
are a lot of disparities.
Yeah,
How about we find ways to take what has worked as evidence and put that contextual aspect on it? Because what we don't want to do, especially when we go from the so-called developed countries into the low to middle income countries, is to not be able to adapt our interventions, our strategies, to make sure that they're culturally and contextually appropriate. So
right,
I tell people that when you're doing this work, you have to have a level of cultural humility that allows you to understand that I'm not coming into this situation with a savior mentality. Because I'll tell you, as someone who does global work, that is one of my pet peeves.
yes,
I just cannot do people who come in thinking they know everything about that community. And it goes back to that community-based participatory research approach that we have to have when we do this global work. Understand from the communities of interest,
right,
what are their needs? How can these interventions that we've proved to be effective be tailored toward their communities in order for them to be effective within the context of those communities? So cultural humility is a really, really important thing. And I think that we need to make sure that everyone who aspires to do this work can do that deep dive introspection and know that whatever knowledge, skill sets, or innovations that you're bringing, make sure that you have, whether it's a community advisory board, a community
mhm,
panel that you're working with, to really understand how can your work be translated into those opportunities that will actually benefit the communities of target. So that's what I would say about that. You can pretty much build a program on anything, whether you're thinking about practice, improving practice, or improving professionalism. This is something I hear a lot, especially in the African context. Sometimes nurses have a bad reputation of not having a good attitude. And I'm like, we need to change that. This is part of being professional.
right,
You can have seminars on professional deportment and what does that mean, developing a professional identity and ascribing to certain values of nursing as a profession. So there's a plethora of things to do. I always say there's so much
Yeah.
pie to be shared. You just have to find where do my skill sets fit and how can I meaningfully contribute.
Yeah, and I think it's so important, like you said, even within the United States or Canada or anywhere, any country, really understanding, like you said, the communities. And even
Yeah,
within the communities, there may be different areas where the
absolutely.
perspective is different or they follow different things, they have different beliefs. Like even in the US, right? Like
Yeah.
historically, with all the trauma, with the structural racism and slavery, it's really
Mm,
shaped certain perspectives of healthcare and like a lack of trust with public health and healthcare. So, like you said,
yeah.
you have to really go in deep and really understand,
Hmm.
build trust, and also
Yeah.
collaborate, like you're saying, with subject matter experts and
Yeah.
also people that are within those communities that really
Mhm.
understand them to develop these programs, like you said, and really tailor them. So that's amazing.
And
And
Farah, not to interject, I think another important thing that we have to think about is sustainability of the things that we're doing. Because
yeah,
sometimes it feels like we go in a community, we do a one-time thing and say, yay, we've done, now let's go and move out. When you're doing this type of work, you have to really think about long-term longevity. How do you sustain these programs that you're starting? How do you make sure that there's a way for either the local community to uptake what you're doing and move with it, or if it's about getting funding and so on and so forth? We always have to have that sustainability issue in mind even before we get started. Sometimes we think of sustainability as an afterthought, but we really need to think about it as a beginning thought before we even implement anything.
yeah, and that's such a good point because even wherever, even within the US, right? You like you said,
Hmm.
there's this type of like education is great. Don't get me wrong. I'm a big
Yeah.
advocate for education, but it goes again back to all those traditional things we learn in nursing, like social determinants of health and
Hmm.
how to get stakeholders involved that will be able to carry this work forward and
Yeah,
that are invested in it and getting key people, like you said, that'll help sustain it so that it's not just like a one and go and
exactly.
you're really training. It's almost like a train the trainer or
Mhm.
developing leaders as you mentioned to sustain all this work. So Dr. Julia has given you some shout outs and props.
I can't wait to be at the NANA conference. I'm so excited. If
In
you're in
November.
the US, please make sure that you come. We are going to be at the NANA conference in November talking about global health and all things global health. So I'm excited about that.
Yes, so definitely we'll drop those links so you can join and attend these conferences. Okay, so we have some people watching from Nigeria.
Hey, Priska, we're talking about global health and how you can be engaged in global health.
Oh, yes, global health, yes, and how every nurse can get involved. Again, to recap, we talked about number one, volunteering with international organizations, getting involved, networking, participating in health education and training
Mhm.
programs, and making sure that they're sustainable. And you work with the key stakeholders to make sure that they keep implementing after the fact. And then number three, you talked about this quite a bit advocacy and policy work. So I
Yes.
know a lot of nursing students, even me in my master's and doctoral level, we did have some
Mhm.
courses on policy work. But it's like some people feel that it's very difficult to get into. I
Mhm.
know the ANA has a lot of work that they're doing, and I'm sure Sigma as well. But
Yeah.
with this, I think it's key to join organizations and even have mentors that are in health policy to kind of show you the steps and the ropes. So, what are your thoughts on policy and advocacy? I know we don't have a lot
Oh,
of work, a lot of time.
we're running out of time. How much time do we have to talk about this? Look, I tell people that in this space, honestly, you can do more harm than good if you're not careful.
Mm-hmm.
Policy work, advocacy work is very important, but you have to be educated on the right frameworks, the right theories, the right language.
Mm-hmm.
Because in policy and advocacy work, language is everything. Meaning and how you put things together, it's everything. So I absolutely love what you said about having a mentor who's been in this work.
Yeah.
That's more than important. The other thing is training programs. There are a lot of training programs out there that will help you develop the skill sets to do this type of work. Sigma has a global academy that a lot of people have participated in, and it's absolutely wonderful. It gives you the right skills, the right words, the right knowledge to be able to do this type of work. ICN has another training program that you can, a fellowship that you can participate in. And sometimes I use this acronyms thinking everybody's on the same page, but International Council for Nursing, we use jargon a lot. And we think we're carrying everybody.
And I
But
missed it. They were in Montreal, and I can't believe I missed it.
no way. Make
Yeah,
sure that you go to the next one. The next biennial congress is
Singapore or something, I think.
Singapore is Sigma, and I'm actually very excited to be one of the keynote speakers.
Of
So I'm in the
course.
opening plenary. So come to Singapore and join us. I'm looking forward to that.
Oh
I'm
my
so
goodness.
excited about that. But Robert Wood Johnson Foundation also has a really good program for policy. And the Jonas Scholars, I mean, there's a lot of different things that you can do to build your expertise in this area. So I'll leave it at that because I know that we're running out of time, but there's so many resources that you can use to help yourself develop, but definitely get a mentor.
Yeah, we definitely will have you back on to talk about more of this stuff. So she says, much needed topic. Oloyeri, especially here in Africa, I'm a social worker and I can relate with the topics. My wife is a mental health nurse as well. Very insightful topic. Yes,
Thank
thank
you,
you.
Olayedi,
Thank
for
you for
joining.
joining. And Priska says, very interesting. Yes, there's so much to cover. And like I said, Mercy is a real expert in these areas. And she's traveling the world. Like, listen, you got to put me in your suitcase. Let's go.
Look, come to Singapore in July. We'll be very happy to see you. And I'm just going to drop one last
Of
plug in.
course.
August, we'll be in South Africa for the Africa Interdisciplinary Conference. I'm excited. I'm a keynote speaker at that one as well. We'll be in Johannesburg. Talk about global health and global work. We're just doing this thing right. So I'm so excited.
Goodness. Girl, we're gonna have to talk offline, and we gotta get going with this stuff. Okay, congratulations. That's amazing. You
Thank
inspire
you.
me, I'm telling you. And I'm sure you're inspiring a lot of people out there who are interested in this type of work. So definitely follow Mercy on LinkedIn and her other platforms. And then quickly, we probably don't have too much time to get into it, but number 4 is really conducting and participating in research and disseminating research internationally so that you can have opportunities like Mercy here going to South Africa, Singapore, and just kind of be global because we know that research is really, it can translate, internationally. So thoughts on that?
Yeah, absolutely. This is something that I'm personally doing. I am trying to expand my work because for some of you who don't know, substance use research and mental health research is my forte. That's what I do in terms of scholarship and research. That's why I'm the director for the Center for Substance Use Research and Related Conditions. But I've really tried to expand my work working in Zambia, for example, with Eagles of Change, trying to do some research there, needs assessment, some intervention work with sports for youth and adolescents to reduce substance use and even reduce the likelihood of initiation of substance use. I'm working with Josephine, shout out Josephine in Ghana. We're trying to do some work with maternal health and really try to improve the mental health outcomes for women who have poor outcomes in mental health and because of pregnancy related complications. And I'm also trying to expand my work to Nigeria So, I mean, there's a lot of places where you can start. So, in fact, one of the things that I want to do in my new role is to really help people make connections with scientists and organizations that are international so they can grow their research portfolio so that we can start making a larger impact in different arenas. So, I do too much. Sometimes I say,
No,
sit down,
you're
Mercy,
not
sit
doing too
down.
much. I love it. I love it. I love it. It's like so energizing to hear somebody
Yeah,
who's really passionate about it. And that's the beauty about nursing because, when people say things like, oh, I'm kind of bored in nursing, I'm like, do you know how much you
there
can
is
do?
so much
It's
to
like
do.
endless opportunities. And honestly, we're going to have to collaborate somehow in the future. I would love to collaborate with you on something.
Yes.
Um, and then number five, for to kind of wrap it all together, we kind of mentioned this before, but
Mm-hmm.
mentorship programs, obviously mentorship is huge.
Mm-hmm.
And then collaboration. So,
Yeah.
and networking. So even just going to conferences, like you said,
Yes.
linking people together, like being
Mm-hmm.
a connector, like you said, you could connect people with other scientists internationally.
Yeah.
Just informing yourself and reaching out and getting multiple
Mm-hmm.
mentors
Yes.
is so important. So, last thoughts for the people out there on that.
Oh my goodness. This when you start talking about global health and mental health and all of this, you get me excited and energized and I go on and on. But just last thoughts. Seriously, you can make a difference because sometimes we're waiting for this big opportunity to think that we can make a difference. You can start making a difference where you are. So don't underestimate the power of one. And Farah,
Mhm.
you talked about this at the beginning of the show. Don't underestimate the power of one. You may not change the world, but you will start ripples that will affect the change that you want to see in the world. And as you are doing your work and you're remaining authentic to the work that you're doing, you're really inspiring others to really get out of their comfort zone because they're like, oh my God, if Mercy can do it, maybe I can do it too. I mean, she doesn't make it look like it's so hard. So maybe, let's jump on this bandwagon. So you never know who you're inspiring with your
Yeah.
work. And then just, in this day and age, sometimes we tend to think about, no, I shouldn't talk about my work a lot. But really, if you don't talk about your work, nobody's going to know what you're doing.
Yeah.
Especially in the African context, we're told to be quiet and not boast and all of these things. I'm like, no, let people know the work that
Yeah.
you're doing because you don't know what other opportunities will come from you talking about the work that you're doing. You don't know what other partnerships you can create. I mean, Farah and I have never met in person, but here we are because we talk too much on social media, right?
I
You
love it. I love
you
it.
never know. So talk about your work. You're not boasting, you're not being prideful. You're just really trying to make people understand what you're doing and the small contributions that you bring to the world to make it a better place. So
I
those are
mean,
my parting thoughts.
yeah, of course. Like I'm telling you, and I am all about as a nurse career coach, and even some people, and you're an entrepreneur as well, a
Yeah.
speaker as myself, and doing a lot of these engagements and things. There is nothing wrong with doing your, regular type work and say academia or clinically with patients, and then
Yeah.
having other aspirations in nurses and business. Like some people don't
Yeah.
understand that part,
Hmm.
but obviously, I'm all about that. Nurses can
Yeah.
do it all. You can do whatever interests you and don't worry
Exactly.
about what people are saying and don't think like, oh, I'm bragging. I'm like, you know what?
Hmm.
Go ahead and brag. It's
Exactly.
part of your brand. And people, and
Yeah.
I think it's a whole nother topic, but nurses don't
Whole other topic.
understand that you're creating a brand
Hmm.
with whatever it is that you're doing. So
Exactly.
like you talked about, it's okay to share all
Hmm.
that you're doing because you're inspiring other people. And Dr. Mercy Mumba, I am very inspired by you. I'm sure everybody else that's watching is inspired. We'll definitely have to have you back on to talk about more juicy topics.
Thank you for having me, Farah. I have absolutely enjoyed myself. I love following your work. You have such a huge sense of humor. I just love it. and
Thank
the big
you.
personality. I'm like, let's go.
I love it. And I can't wait to meet you in person at one of these conferences.
Yeah.
And tell the people where they can find you besides LinkedIn.
They can find me on Twitter. I am, or X now. I am at Dr. Mercy Mumba 1 on Twitter. You can also find me on Facebook. I am Dr. Mercy Ngosa Mumba on Facebook. My personal page is Mercy Ngosa Sukuma. That's my husband's name. So you can find me on all these different platforms.
Awesome. And your website? Did you share your website?
My website, you can find me at, oh my God, which one do you want? You can find me at mercymumba.com. You can find me at ccirc.ua.
Google her.
Google me.
Google her.
And you can find my book literally everywhere books are sold, on the Sigma website. You can find it on Amazon, and I'll be happy to sign it for you whenever we meet at a conference somewhere. Just stop me.
Awesome. And I'll try to share some of the links after. Just send them to me. We'll put them in the links. And I just want to say thank you to everybody who's joined. I really appreciate it. Thank you for making us feel better today, because we're getting a lot of love out here. So we appreciate it. So thank you for watching. And for those of you who have enjoyed this show, definitely subscribe to my YouTube channel. Follow me on LinkedIn. Follow Mercy.
Oh, yeah. You can also find my YouTube channel.
Yeah. Yes. Google us. We're doing big things out here. We're doing out here
on YouTube too.
in these nursing streets. So definitely, it's been such a pleasure. Yeah. I'll have to have you back on again and again. Thank you all for watching.
Thanks, everybody.
Have a beautiful day. Stay on for a second, Mercy. Okay.